Alright, we're going to go over some of the basics of adapting your instruction to the participants in your class. So, you're a ballroom basics for balance instructor, and you've collected all this health history information. You know a little bit about your participants based on kind of what they reported to you, or maybe some conversations you had as they were getting set up for the class. And now you're trying to take all that information and kind of incorporate it into your instruction. And modifying things when it's appropriate. So maybe they've got pain at either their hip or their knee or their ankle. Maybe they've got a bunion in the foot that bothers them. You've also got some people who are in small spaces. They're kind of cramped spaces. And you notice that they might not be able to move the best in those areas. They also might not all have the best footwear. So, we always recommend trying to use shoes that are supportive, but that don't have a really significant tread on them. So these shoes, pretty slick on the bottom, enough tread that you feel comfortable, but not so much that you're going to be getting stuck when you're moving from place to place as you start dancing. Also, ideally, this floor would not have a rug on it. So if I was using this room to dance on a regular basis, or one of my participants was, I'd see what the options are for just rolling up that rug, changing the environment, making sure it's safe for everybody. So those are some things to think about in addition to some of those physical things that your patients might have reported on their health history. It's kind of what are some things we can adjust about the environment. So related to people who are having issues with their lower half, we're just going to talk about maybe a simple thing that you could start out with before you begin the dance step. Whether you're sitting or standing, it can be helpful to think about incorporating a grounding exercise at some point in your instruction. So, for example, just have your participants stand and then turn their attention to notice the way you're standing. How wide are your feet? Where do you feel the weight in your feet? Do you feel it more towards the front or the back, or is it right in the middle? What else do you feel when you're standing in this position? Do you notice discomfort anywhere in your body? Do you have pain? Make note of that. Is this something new? Is this something that's a concern? Is it something you need to talk to somebody about, myself or a healthcare provider or somebody that you trust? And overall, just kind of do a little body scan and notice, do you feel stable on your 2 feet? If you don't feel stable, is there an adjustment you can do? Can you make your feet a little bit wider? Does that make you feel a little bit more stable? Maybe you need to adjust where your balance is on your feet. Maybe you need to grab a chair. Put it next to you. Hold on to that to just kind of get your bearings for a little bit here. That can sometimes help too. So that's just a good way to kind of be aware of where you're starting from. And from there, let's say that we're starting out with just some basic merengue movements. So we're just doing it in place to start with. And you're telling them about being able to start on your toe and go back to your heel, and being able to do that and kind of switch your weight from one side to the other and let your knees pop out in front of you so you get this nice hip wiggle going on. And you're working on all of that, and then you remember, oh yeah, somebody's got a bunion. So then maybe you recommend that, hey guys, if it's uncomfortable at all for you to be on your toes, just go ahead and do this with flat feet. That works just as well, and you can still get your hips grooving. Or if the hips moving side to side is uncomfortable, think more about stepping side to side and just shifting your weight that way if you're feeling some discomfort in your hips. If you're noticing that having your knees bending that much is a little uncomfortable, keep it up nice and tall. So just kind of find the area that's comfortable for you. Now let's say you're onto the regular merengue step and you're moving forward and back. So I'm going to start back here and you're moving forward and then you're moving backward. And you notice that some people are really having trouble keeping up with that. So a modification would be take some smaller steps. Just let's do some baby steps here. And keep going. And back. Now the other thing to be aware of is maybe some people are able to slide forward on their surfaces, but some other people might not be able to handle that. So if that's the case, then just recommend picking up their feet instead of gliding. Another thing is maybe you've got somebody that's working with a walker, and instead of going forward and back, if that's an issue, then you could always have them have the walker right in front of them and just work on going to the side and just take a couple steps to one side and a couple steps to the other side. So for example, if the walker's here, I'm going to show you from the back side. You can have them do the merengue, 2 steps to the right, 2 steps to the left, 2 steps to the right, and 2 steps to the left, instead of taking 4 steps to the right and 4 steps to the left. So you could just do a little bit of a change there as well. So those are just some ideas of things to be aware of. Checking in with your participants to make sure that they're working in their pain-free ranges and that they're comfortable with being able to do the dance steps. So those are some ideas of modifications for the lower half, and we'll give you some other ideas for other things that might come up in your sessions. What other things do people commonly complain about? I'd say that one of the common complaints I hear in the clinic is, oh man, my back's aching, or oh, I've slept wrong and now my neck's sore. But there's a lot of people who deal with back pain and neck pain, and it can be low or high or in the middle on a daily basis. So if people are reporting a history of back pain or neck pain, one thing that might be helpful is during your warm-up, start out by incorporating some neck movements. Have everybody turn their head as far as they feel comfortable one way and as far as they feel comfortable the other way, and just do some range of motion, looking back, looking down, tip into the side, tip into the other side in the pain-free range. So that would be one way to kind of loosen up the neck. Another thing would be to encourage when they're sitting or when they're standing, think about keeping that spine tall. If you're standing, same idea there. Maybe you think like somebody's pulling your hair on the top of your head, but just encouraging while you're dancing, to keep that upright posture is an important thing. That can help out for the spine for sure. Now there may be some people who have to lean forward and touch the chair, or who need to be in a position where they have some support, and for those people it might be a little more challenging to stand erect, and that's okay. But just be aware that you can still encourage those ideas at times during your sessions with Ballroom Basics for Balance. Another thing to be aware of for people with back pain is to notice if they're staring at their feet. So let's say that we're doing the East Coast swing. Alright, and so people are figuring out, okay, I gotta go 1 step, 2 steps, and then this rock step. And I'm trying to figure out, and I'm working so hard, and I'm doing this. You can see how that might play a role on causing some neck or some back pain or being uncomfortable. So if you're noticing that, you can remind people, keep your eyes up, keep your eyes forward, see if you can find a spot on the wall that you can stare at, if it's somebody who keeps looking down, and focus on that spot as you're doing that swing step. So that's something that you could also encourage. Another thing you could try is just having them sit down, you know. Maybe they need to focus on their feet a little bit more. Maybe they need a break because they're starting to get more back pain or more neck pain. And they can do the same step, just sitting. Being able to go from one side to the other, and they might understand it a little better and be able to keep their head up a little better then too. Say you're at the end of your session and you're cooling down and you're doing some stretches, and some of those stretches involve kind of bending over. I just always encourage people to be in their pain-free range. Maybe you're doing a hamstring stretch for the back of the leg. When I teach patients to do this stretch, I always try to encourage them to keep their back straight and bring their chest forward. And that way it's a little bit less straining on the back versus folding over the leg. So just kind of an idea that you can always kind of cue for the back, even just when you're doing simple stretches. Alright, those are some ideas for what you can do for the spine. Hope those are helpful. Alright, now some other concerns that came up on the health history is that, you know, some people have an issue with dizziness. And that can be a little bit trickier at times, but let's say you're going along with some teaching, maybe you're doing the rumba, okay? And so with the rumba, you're starting out up front, and then you're having them step back, and then to the side, and forward, and to the side, and back, and to the side, and you're just kind of going around and doing that box step. So overall, you're just kind of going in a small circle, and you don't think much of it, but you notice that some people are kind of seeming a little off balance. So that's a good reminder to, okay, everybody, let's take a break here for a moment. Let's find our seats, and let's just practice the steps. Let's do a seated break for a little bit. Or, you know, don't even practice the steps and just kind of hang out, encourage people to grab a water break. Sometimes they need that encouragement to stay hydrated when you're working, so that could be a good opportunity as well. But other things to be aware of for people who might be experiencing some dizziness on and off is to encourage them to stop and sit down when they're experiencing that. Take some deep breaths, you know. There's never a problem if a participant sits down during a session. We probably will check in with them, but still, just kind of reminding them, when you need that time, just go ahead and have a seat, take some good deep breaths, get a water break, whatever it is you need. But that breathing can be really helpful for those people who are experiencing the dizziness too. Also, sometimes when people are watching what's going on, they might be looking down at their feet, they're looking up, they're looking to the side, they're kind of turning their head all around. So maybe encourage them to stop moving their head so much and just stay in one direction so that you're just focusing on the teacher, or you're just focusing on listening with your ears. For those people too who are vision or hearing impaired, using those hand movements can be really helpful too. So as we're sitting here, so now everybody's stepping back to the side, now forward to the side, and back to the side, and forward and to the side. So that would be an option for trying to help out with those people who have difficulty seeing or difficulty hearing what's going on, is kind of using your hand motions. And me pointing might work, or it might be more of kind of direction with your arm one way or to the other way, or just forward and back, you know. You can kind of figure out what works well based on your space. So maybe instead of doing the whole box, you're just focusing on, I want you to just step back and step forward. and step back and step forward. And so you're just getting that part of it for those people who are having trouble with turning their head every which way to try to figure out how the box step was going. So just breaking down the steps. Also, you might have a song that you put on that's a little faster than you thought, and so all of a sudden you're doing a box step and it's a lot quicker than you imagined. So then you can say, okay, we're going to actually change this a little bit. We're going to do this in half time. And that can be helpful for those who might be having heart issues, who have difficulty breathing, people who just have difficulty with the rhythm aspect of dance. So it can be beneficial for a lot of people, and it's actually a lot harder to move slow than it is to move quick a lot of times. So then you kind of break it down and say, okay, now here's our new tempo, and then you're dancing together, but now this time it's here instead of that fast, quick stepping. So it's 1, 2, 3, 4, 1, 2, 3, 4. So, slowing things down can be a huge benefit also. Other than that, it can also be important if people are experiencing dizziness or they're having issues with feeling like they're overwhelmed or that they're overworked or overexerted, then position them by a chair at their home or by a wall. So either one can work quite well. If they're by the wall here, ideally it wouldn't be a wall with a picture on it, but we'll assume that that's not there and they're just holding on to the wall, and they can still be doing all the dance steps with you, but they'll just be doing them a little bit smaller and staying so that they can have one hand in contact with the wall, or if they feel more comfortable, they can have a wall on one side and a chair on the other side. So here, I can still do my box step for the rumba, going back to the side and forward to the side, but this time I've got support on both sides and I feel comfortable. So those are all ways that we can try to incorporate allowing people to feel more comfortable. Now overall, these are just some ideas and modifications and adaptations that you can make when you are instructing a dance class. Obviously, each class is made up of a variety of different people, of different levels, different ages. So the main point is just to consider that and try to incorporate ways that you can be attentive to what some of your participants might be experiencing with some of the things you're teaching. So checking in with them on a regular basis to try to see if they have any symptoms going on. We encourage in Ballroom Basics for Balance, if you're feeling dizzy, short of breath, or you're feeling pain anywhere, to just stop. Stop the activity, stop the dance, stop the exercise, whatever it might be. Take a break, sit down, give yourself a breather, and at some point either tell your instructor what was going on or a health professional. Hope that gave you some ideas of things that you can do as an instructor and gave you a few ideas that maybe you hadn't thought of before of how to adapt things for your participants so that it's appropriate for their level and their physical health, with attention to also what their environment is and what they can change about their behavior to make things safe, fun, and overall therapeutic.